point of personal privilege for me to be able to introduce Sandra. The reason I wanted to do that is because I'm working with her in this organization, but I am really very much in the background, and she would say something different about that. But I want you all to understand who she is. I've known Sandra since she was Sandra Bobo, and she's been Sandra Bobo Gaskins now for 14, 15 years?
I think 14.
14 years, somewhere in that range, I guess. Sandra and I have known each other for at least 20 years. I've watched her little girl Savannah grow up to be this wonderful young lady. She's been in public relations. What I really want you to understand about her is how passionate she is. And when she grabs hold of something, she never lets go. And so when the Dobbs decision came down 2 years ago, she said to me, "We got to do something about this." And I thought, well, what in the world are we going to do about it? So she grabbed Marilyn Van Order in Rotary and me, and the three of us sat around and noodled for months about what in the world are we going to do. So this is the second forum we've had, and I'm so appreciative of you ladies and your expertise and what you're going to bring to us. But what I want you to understand is Sandra is the one who's making this happen. She'll call me and say, who do I need to call? And maybe I'll know, but she's the one who does all of the work. And so I appreciate your passion. I love you, Sandra. I know that there is going to be a time when we can get this reversed, because it needs to happen. It needs to happen for the young ladies who are in this room. It needs to happen for your daughters and your granddaughters and my great-granddaughters. And so Sandra is the driving force behind this. In addition to this, she's serving as the president of the Hendersonville Rotary Club this year, and I'm like, when do you sleep? But if you all will please help me give a great round of applause to Sandra Bogo.
Don't let Brenda fool you. You know how busy she is and how she gets her fingers and toes involved in the things that she's passionate about as well. So yes, it's a group effort, that is for sure. And one of the ladies I had the privilege of meeting through my sister-in-law was Dewana Wade. So when we did our first forum back in March, the end of March, Dewana stepped right up when I said, this is what we need. I need a moderator, someone who can be who understands how to keep the conversations flowing. And she did such a fabulous job last time that we're like, please come back, and she was all in. So let me introduce Dewana to you all. And before I do that though, let me say thank you all very much for bringing this forum to the League of Women Voters here. That is one of our missions, is to basically educate as many people as possible about how these laws have impacted our daughters, our sisters, the young mothers, and the children that these are affecting. And then I truly believe that when people understand what's happening, they are not going to support this. And we get the right people into office, they will make changes that will improve the lives, once again, of our Tennessee families, everybody included. So thank you again for this opportunity. Dewana Wade, she's the CEO of Salama Urban Ministries, and it is committed to continuing the stellar services Salama has provided for more than 38 years. Dewana has previously served in multiple leadership positions within the YMCA of Middle Tennessee and the YMCA of Greater Kansas City. Dewana is well versed in the areas of youth and community development, strategic planning, and executive coaching, and has served as a consultant and mentor to organizations, churches, and individuals in these areas. She currently serves on the board of directors of Aventura Community School and Invictus Nashville Charter School, having recently completed 2 terms of board service with the store and the Plant to Seed. Her board and service within the community have primarily been in the areas of education, justice, and equity. Her most important role, however, has been as parent to 2 adult children and guardian to her niece. Please welcome Dewana Wade.
It
afternoon. Good afternoon. It is a pleasure to be here, and thank you, Sandra and Miss Brenda, and all of you for being here on this Saturday morning. It's a beautiful, beautiful Saturday morning, and this is a really busy library. I don't believe that all of the people here are here for us, but I think if they came in, they'd learn a lot. And so I'm excited to be here, and I'm most excited to be able to introduce to you the experts for the day. I just get to stand here and talk a little bit and try to, again, keep the conversation moving. And so I'm excited to be here because it's a very important topic. And so it's also, does anybody notice anything about me and what I'm wearing today? It being after Labor Day? I'm wearing white, right? Now, how many of you all were taught don't wear white after? So was I. And so my grandmother, I'm sure, is looking down and frowning at me right now. But we're bucking the system. I'm bucking the system and wearing white. And also, it's one of my favorite dresses. But in bucking the system, the conversation that we're about to have today is also about bucking a system that is a little oppressive, that is a little out of touch, that is a little not good for people in general, but for women and young women specifically. And so if we can wear white after Labor Day, we can make a change in the things that we're talking about today. And so I feel good being in the room because a lot of you are like, oh my God, my grandmother and my mom made me not wear white after Labor Day. You are free. You are free. Wear white, ladies. Wear white. Wear white. And so we are here to recognize the topic of women's reproductive health. It can be considered sensitive, but the purpose of our panel discussion today is not to evaluate the broad question of pro-life or pro-choice. It's simply an educational forum, providing factual information on a variety of medical issues and outcomes impacting treatment for women resulting from our current Tennessee law. And so now I have the pleasure again of introducing to you my new friends, Stephanie Jacques and Dr. Nicole Schlechter. Stephanie Jacques is she's a Davidson County organizer with Planned Parenthood of Tennessee and North Mississippi, Tennessee Advocates for Planned Parenthood. As a Planned Parenthood organizer, she spearheads the Deploy Davidson initiative to activate and mobilize volunteers in critical background districts, which is probably about 92 districts and counties in this state. She holds degrees in music and Black Studies from Howard University and California State University Northridge. Her background includes a dynamic career as a songwriter and recording artist based in Nashville. She's originally from California, and she's passionate about advocating for reproductive rights and using her creative and academic expertise to engage communities in meaningful action. I present to you, ladies. I did see one gentleman. I knew I saw some gentlemen. Ladies and gentlemen, I present to you Stephanie Jacques. I also have the pleasure of introducing Dr. Nicole Schlechter. She is an OBGYN hospitalist, an OBGYN ED attending, emergency department attending, at Ascension St. Thomas Midtown Hospital. How many of you all remember that as Baptist Hospital? I do. I still call it Baptist. My baby girl there was born at Baptist, but she is engaged there. And so, Nicole Schlechter was the first in her family to graduate from college. After graduating from the University of California, Berkeley, she stayed on as a graduate student conducting research in comparative endocrinology. Dr. Schlechter came to Nashville to attend Vanderbilt University School of Medicine, and she's a founding partner of Women Obstetrics and Gynecology, where she spent more than 25 years with the practice in direct patient care. She also found herself, however, taking on increasing leadership roles at the hospital and in organized medicine. She, at one point, was the chief medical officer at Ascension St. Thomas Midtown. She served as physician-in-chief for women's services, also at Ascension, and as physician supervisor with Connectus Health Midwifery. Dr. Schlechter holds also a PhD, and she is currently, again, an OBGYN hospitalist and an OBGYN ED attending. Dr. Nicole Schlechter. background on how this conversation is going to go. We will have questions, we already have questions selected that we're going to ask the panelists, and you all also have an opportunity to share some questions with us. So at your tables, at your chairs and tables, there should be an index card. If you have a question that is burning that we have not asked of our panelists, you can write that question down. You will be able to bring those up to us. Probably Sandy and another operative in the room is going to be able to pull those for you. And as time permits, we are going to then be able to ask those questions as well. All righty. If you would, we'll start with you, Ms. Jacques. If you would, note briefly why you chose to be a part of this discussion.
For me, I come from California, where we still have reproductive rights. And so when I joined the Planned Parenthood organization, it was truly because we were at fear of the rights going away. And then through my time there, we have lost many a right. And I just feel it is very important for people to know in this state what is happening. I think that the information, there's a lot of misinformation that has been spread. People should know what the actual laws are, what the risks are, and I feel like it's just important.
Awesome. Wonderful. We agree.
Yeah.
We agree. Dr. Schlechter, the
First,
same.
I feel compelled to say that not everybody is from California, just everybody at this table. But I came here in 1986, so I was before the current wave of everybody moving here from California, so. But this is an issue that I've been passionate about since before I went to medical school. So that was actually in California, but as a provider of care to women for the last 30 years in Davidson County in Tennessee, this is really important to me, and to watch how these new laws have impacted my fellow physicians and other providers and the people I take care of has been devastating. And I think the biggest problem is that people don't understand what the laws did or what they have done. And I think they just see it as pro-life, pro-choice, which I don't believe in either of those expressions, just so you know. But that's not what this is about, and I'm so excited that you're nodding. That's making me very happy. Yeah, that's not what this is about. So that I just feel compelled to help get that information out to people, because I am finding a huge amount of misinformation that's distressing to me.
That's all really, really important. And could you all hear their hearts as they were talking about this? And clearly it boils over into your work. So we're very appreciative of you all being here and being able to share your heart. So here's a question for the audience. Are you all able to hear, or you're probably able to hear because I'm the loudest mouth in the South, but would it be helpful for our panelists to use the microphone?
Yes.
Okay, sorry, I talked too fast, sorry.
We both talk fast.
Yeah.
So just.
It's the California in you, I believe. All righty, we're just gonna jump right in and ask some questions, and because there are two of you, you'll probably both be able to answer these questions as we go along, and I will probably not defer to one or the other unless a question comes up that suggests that. So first, how about explaining to us what the anti-abortion laws are in Tennessee? And each of you also have in your seats a synopsis sheet that tells you some information about it. Anytime I read laws that come from the state legislature, oftentimes there's a lot of what I call gobbledygook in them. And so from the perspective of someone who is not well versed in gobbledygook, please.
So for the abortion.
Is it on?
Is it on?
Just hold it,
There we go.
talk louder, though.
I'll just talk louder. I'm a singer. I can project. So there are basically no exceptions to our abortion law, except for if the mother is at risk of losing life. But it's a very nondescript way. It's up to the doctor to kind of tell that. So it puts physicians in a position to determine that. There are no exceptions for rape, incest, age. It's one of the strictest abortion bans in the country.
To that, and completely what you said, I need to start writing notes while we're talking, because, so to be clear though,
I don't think
yeah,
that's.
that's
No,
law does not say that a woman cannot seek or have an abortion. The law says that a provider cannot provide an abortion.
Yes.
A patient is not at risk of, or the woman receiving the care is not at risk of being charged, in this case, from this law, but they could still get a civil liability, but they can't get the law is against the providers, so that puts providers at risk because we also don't know gobbledygook. We know our gobbledygook, we don't know legal gobbledygook. So we can't say exactly what imminent risk of life or harm to major bodily function, which are the two exceptions that were put in place subsequent to the Dobbs decision that went to the trigger ban that went into effect in July of '22. So currently, we don't have a definition of imminent risk. There is no legal definition of that. There's no medical definition of that. So we are in a position of not knowing how to care for you and your children and your loved ones.
Awesome. We have a microphone now, so. How have the anti-abortion laws changed your approach to treating pregnant women and girls?
I think for both of us, it's a little different. With Planned Parenthood, we cannot provide abortions any longer. So we do provide many other services, which a lot of people don't know. We do vasectomies, we do cancer screenings, we do birth control, we do education services. So that is where we pour a lot of our resources in. And then we also have navigation services to help women find abortions outside of this state.
For us, again, we don't know what we can and we can't do. So it depends on the provider, it depends on the patient, it depends on the circumstance, but I work in a GYN emergency department, so I see someone who comes in pregnant and bleeding, or someone who comes in pregnant and hurting. When this law first passed, there was not an exception for an ectopic pregnancy, which is a pregnancy in a fallopian tube. I'm gonna tell the story, can I tell the story? I'm gonna tell the story. So I was working in the hospital, and there was a patient who was admitted to the intensive care unit. She was visiting from out of state for a convention or something. She was in a hotel room and she collapsed. Her fiance started resuscitating. He knew CPR, and she was actually coding, and he started resuscitating her, brought her to the hospital. In the ER, they were continuing trying to resuscitate her, and they realized that she had an ectopic pregnancy that had ruptured, that was in her abdomen, that had bled into her abdomen, and she was admitted to the ICU. They rushed her to the OR and treated that and got her to the ICU, but she was brain dead. So we lost her. And that was because she didn't know she was pregnant before that. Well, that same day, we had a patient in the GYN emergency department. I was not working there that day. I was the physician chief of women's services that day, so I was the person that was in charge of all the doctors who worked and cared for the women in my hospital system. And I was their principal, you might say. And this patient presented to the emergency department having pain in pregnancy, and she had pregnancy in her tube that was about this big, one of the biggest ones I've ever seen, and I've been doing this since 1994 when I started my practice in Nashville. It was huge, and it had a heartbeat. To remove that pregnancy from that tube, from that patient, was a Class C felony. And I told him I told the doctor who was in the ER that he should do it, and if he wasn't comfortable doing it, I would do it. I did what the lawyers had counseled me to do, which was wrote an extensive note to follow his extensive note to justify doing it. She was not at imminent risk. In that second, she wasn't bleeding, she was stable, her blood counts were fine, but she could die, she could rupture and die if I sent her out of the hospital. Were we to keep her in the hospital until she started bleeding? Or send her home and say, when you start bleeding, you pass out, you come back. So that's one story about, sorry, I'm not sure if I'm answering the question, but I had to tell that story. Other stories can be told about a hospital, not mine necessarily, but a hospital in Nashville who, early on at least, there was a patient who presented bleeding with a miscarriage, and they had to consult the physicians had to consult the lawyers for the hospital before they could treat that patient, and that patient sat in that ER for hours, much to the stress of her family, and the doctors caring for her before she could get the care that she needed to handle that. So it's delays in care and questioning whether we can do the care that we need to do.
Thank you for that. And so, yes, you may absolutely, at any time, tell your stories. Go ahead.
And I was going to say, I'll follow that. I shared earlier, third, that I had a miscarriage right after the Dobbs decision, and I had to wait, and my treatment was delayed because they had to make sure I was miscarrying, make sure that I wasn't trying to go around the system, like that it was emotionally exhausting. And for me, who knows all the ways to go about it, who has all of the education, the experience, the contacts to still be sitting there in that situation and all of us be frustrated when at that time you should just be getting care, is one of the reasons that we are discussing this today.
Thank you both for that, because it doesn't sound like you've changed how you two would serve people who come to you, but having to then pay attention to all the other pieces and people and places and things, those changes have then negatively
Can I expand
had
on that?
consequences.
Sorry,
Please.
and we might not get through all the questions, sorry. I talk a lot. So, yes, it doesn't affect how, I try not to let it impact how I care for patients directly, but for example, some physicians it does. Younger physicians who are still trying to pay back their student loans, which are exorbitant, by the way, in case you don't know. So paying back their student loans or supporting their families. We had a case in one of, not a Davidson County hospital, in another hospital, where there was a patient whose water was broken at about 17 weeks, and the fetus had a heartbeat. It was literally hanging onto the cervix, like, I'm not kidding, this is sort of gross, but like arms in, torso in, legs in the patient's vagina. But she just wasn't passing it. There was no way that that fetus would ever become a viable pregnancy, would ever be able to live. Patient would ultimately get infected, and the fetus would ultimately die. If it was ever born, it would never be able to, it wouldn't have developed lungs. It could not live, I promise. So, but it had a heartbeat, so it would be a Class C felony to assist with that happening. And she was not at imminent risk because she was not yet infected. She would be. The physician taking care of her called me when I was the physician chief of Women's Services and said, what do I do? And I got permission from our hospital system to proceed. But she said to me, I can't do it, Dr. Sector. I'm the sole provider for my family. I have 2 little kids. If she got charged with a felony, she would have to do a data bank report. She could lose her privileges at the hospital. She could lose her malpractice insurance. She could lose her livelihood. She couldn't do it. That patient spent the night in the hospital until an older physician relieved her the next morning, gave her a single dose of the medication, and the fetus passed. The patient did fine. They're sorry about that.
This is,
So it's
these are,
impacting how some people are practicing.
exactly, exactly. And this is the information that we need in this educational forum. And going further, in your work with caring for pregnant women and girls, obviously there have been times where challenges and complications have arisen. Lupus, undergoing cancer treatments, and things of that nature. What are some of the challenges you have faced and experienced?
We have a very vigorous blood cancer program at the hospital where I work, and there's a certain kind of, and I'm not going to be able to do this well, okay, I'm not a blood cancer doctor, but I can't even remember if it was a lymphoma or leukemia. There was a female patient who at the early pregnancy, second trimester, somewhere between 12 and 23, before viability, was diagnosed with a terrible blood cancer. And the chemotherapy that was required is contraindicated in pregnancy. You do not give that to a pregnant person. It could kill the fetus. The oncologist was mortified and refused, basically, I'm not shaming anybody, really was very reluctant to treat this patient with that medicine while she was pregnant. The patient had children at home who she wanted to live and take care of. She wanted to be able to survive her cancer, which was a bad cancer, and take care of her children. She wanted to terminate the pregnancy. We couldn't do that for multiple reasons, but we couldn't do that. We couldn't even send her somewhere in the state of Tennessee to do that, and he couldn't give her the chemotherapy. He wouldn't or couldn't give her the chemotherapy that she needed. So yeah, I mean, it hits other, one other story. I got a call from a friend of mine who's a dermatologist, who's very active actually in Tennessee Medical Association stuff. So should know the laws, but he's a dermatologist, and he had a patient who was on tretinoin, I always forget the name of the medicine, which is that acne medicine where you cannot get pregnant on it. It causes such horrible, horrible abnormalities in the fetus that it is, you have to have someone be on 2 forms of birth control, and they do monthly pregnancy tests on you to re-up your medication. I mean, it's that bad to get pregnant on this medicine. And he had a patient who was pregnant on tretinoin. And he called me to say, so where can I send her for? She wants to terminate the pregnancy, where can I send her? I'm like, you gotta send her out of state. He had no idea. The patient had no idea, because people don't understand the law. And that's the problem. So she had to go out of state to get that treatment. That fetus was never, again, that fetus was never gonna survive. This isn't like, we are just, yeah, let's get pregnant and I'll just have an abortion. This is not what this is about. This is about care for patients.
Now, these are very important considerations, because we don't know the law. I was at the forum in March, and I don't know the law. And so being unable to make decisions for my family without all of these considerations. So please don't ever apologize for telling the story. Go ahead.
And I'll say this, if you didn't know the law or you don't know the law, you shouldn't be shocked. At Planned Parenthood, we have been calling phone banking across the state, and I would say a high percentage of the people that we talked to on the phone did not know what the ban entailed, or if we even had a ban. So it has not been publicized as wide as people think it is.
And wasn't there a quote from Senator Briggs who proposed the original trigger ban that he didn't understand? He said that he did not understand the impacts that it would have. So you're fine. You don't get it.
I'm going to jump out of the law questions just for a moment. Can pregnant people be charged with a crime if they don't change their medical treatment or medicine that is likely to cause damage to a fetus?
As of now, no, they cannot be charged with a crime, but laws are ever changing. So at Planned Parenthood, that's obviously where our concern is making sure people know what those laws are. Now, you can speak to the physician. A lot of this is on the physicians at this point.
Yes, so that begs the question, can a doctor be charged? For example, if that oncologist had given that patient that chemotherapy, could they have been charged? I don't know. But I can tell you, I mean, the Catholic Church, which has pretty strict abortion laws, I think most people would say, would be okay with treating that because it's a matter of secondary intent. That's a Catholic law. So it would be okay within the Catholic Church, but it's not okay within the state of Tennessee, as far as we know. No one's ever been charged. No one has been charged, but it's a question.
It's a gray area.
And ultimately, the gray area is where people who go to hospitals or clinics, et cetera, are stuck with people trying to make decisions about whether they can or cannot access good health care.
Correct.
What are the physical and emotional risks for young girls aged 10 to 13 who become pregnant?
Well, first of all, I get that people are getting their periods at 10 years old now, but when I was, anyway, that's new. People are getting their periods, their first period, or younger and younger, so able to get pregnant younger and younger. That's because of, you could hypothesize all sorts of things. I think it's plastics in the environment, but we can talk about that in another forum. But so their bodies, though, are not yet ready. The rest of their anatomy, they have eggs, they have a uterus, but the rest of them is not prepared. So it can have long-standing physical effects on a person's body. I mean, just changing their anatomy and changing, the joints become relaxed, the bone, the cartilage becomes relaxed during pregnancy, so that changes the way, it can change the way they walk, it can change the way their pelvis sits. It's incredibly unhealthy. And then the psychological, I apologize, we don't have someone who's an expert at that. I'm not an expert in that, but I have been a young girl and I have taken care of young girls. It's devastating. And then again, oftentimes this will be from rape or incest. And that's also got a huge psychological impact. I think that it's horrifying. And then there's the trafficking ban. Do we want to talk about that yet? Is it time? Do you want me to wait till another question? So there's currently, it's now on hold because of federal judges, and I'm looking at you because she's got the legal expertise. It's been put on hold, but there's a law currently in the state of Tennessee that's called the abortion trafficking ban. So the only person who can help an unemancipated minor go out of state to obtain an abortion is a parent or legal guardian. So otherwise you're charged with, what are the terms? I wrote them down so I wouldn't forget, because I always forget. So if you recruit, harbor, or transport a pregnant, unemancipated minor for the purpose of concealing, procuring, or obtaining an abortion, too bad I can't read my own handwriting, including abortion-inducing medications, you can be charged, it used to be a Class C felony, they've changed it to a Class A misdemeanor, which can be 11 months and 29 days, I wrote it down, in prison. So if your niece was raped by her stepfather, you are not allowed to help her obtain an abortion. So that would also be an emotional issue, because you'd have to go to your rapist or your rapist's wife to get an abortion. Sorry, you want to talk about it?
Go right ahead, I figure you have something to add here, Ms. Jones.
No, and I will say, that kind of goes into another question we're gonna get into, but we offer navigation services at Planned Parenthood to help women go to other states to obtain an abortion, and this impacts that, because if they are a minor, it has to be their parent or guardian, and we cannot help them without that approval. And they have to be able to, the child can't give us, because they're a child, cannot give us their consent, it has to be the parent. And so even if we have the funds to, and have the resources, our hands are tied at Planned Parenthood.
And so going to that question, how can you get abortion health care without funds to travel?
You can. If you, an abortion usually costs around $800. You're not working, you might need childcare, you need transportation. So even if somebody gave you the abortion for free, it is costing money. So you have to find organizations that will help you if you do not have those funds yourself. So we have Planned Parenthood, we try to navigate, get you to places, you have to make the appointment yourself. But if you do not have funds or you do not know who to speak to, it is nearly impossible to be able to get an abortion.
Which means this law is disproportionately impacting people who don't have resources, which a lot of our laws do. Also, in my ED, I take care of a large undocumented population, and I don't, whatever you feel about undocumented people, they still deserve health care, and they still deserve care for when they're having a miscarriage. But our hands are tied.
There's a theme, our hands are tied.
Yes.
And it's really unfortunate because of all of the small things that we've touched on that probably before we got here today, we didn't even necessarily connect the dots around, which is really, really illuminating, for me at least. What is a fetal anomaly?
Fetal anomaly is an abnormality of the fetus. So anything from, I have a dear friend who was born with amniotic vein syndrome. She's got these tiny little fingers and toes, and she is a genius. She's got a law degree and passed the bar, and she was a national banner journalist. So that's a fetal anomaly, though. She had an abnormality when she was a fetus, and she still has it, and that's okay. But a lethal fetal anomaly is an abnormality of fetus which it's not survivable. I'm going to use an example of a patient that I know personally who had an anencephalic baby. An anencephalic baby doesn't have a brain or a skull. That fetus can survive all the way to term, absolutely, because you don't need to think in there very much, and the mother supplies all the food, nutrition, heartbeat, yada, yada, yada. But when the baby comes out, it dies. The problem is that carrying a pregnancy is also hard on someone's body. Anyone? Yeah. Right? I'm right. Okay, I'm gonna do this. I'm a childless dog lady myself. But having delivered over, I had to do it. Having delivered over 4,000 babies, I do know that a person's body takes a toll from having carried a baby, delivered a baby. So you do that with an anencephalic baby, and then you deliver a baby, and you don't get to take it home from the hospital. Or you have to explain to your other children why that baby that they watched you grow doesn't get to go home from the hospital. And a 3-year-old or 5-year-old shouldn't know about anencephaly. I'm sorry, I'm sorry, thank you though, thanks. Sorry. So a great example. So we did, in my former practice, had a patient, but this was after the law. I wasn't in that practice anymore, but it was still, I'm still very tied to them. So we had a patient with that, and she thought her doctor was being a bitch and not taking care of her and being reluctant to help her when her doctor's hands were tied because she couldn't do anything, and she ended up going out of state to get that pregnancy cared for, terminated, so that her child would not have to go through that, and so that her body would not have to go through that, and so that her emotions wouldn't have to go through that. Unfortunately, she had a complication. She had what we call retained products, which means that part of the placenta or part of the membrane stayed inside her and caused a horrible, horrible infection. She had to be admitted to the hospital when she got back here for like 10 days of antibiotic. It was awful infection. So that may not have happened had she been able to have the procedure done here, which should have been able to do. And because that would have been caught earlier and treated faster, and probably could have been treated as an outpatient. So, sorry, your question was, what is the fetal anomaly? Did that make sense? Any questions about that?
yeah.
Okay, sorry. I can give you lots of other examples of fetal
Please
anomalies.
don't apologize, because
I
our
know, it's
interest.
my old PhD guy always said, shut up, Nikki.
Make it quick. And so that really does answer a couple of our other questions about a legal abortion being an option when there's one or more anomalies. And here in Tennessee, it does not sound so. And our question from the audience, please don't forget that you can ask us questions as well, and we will come pick those up if you need. But what are the closest states to Tennessee for travel for abortion services?
We send people to Illinois a lot for abortion services. It's always changing, but that is our main resource, and it is a quick travel. We try to find places that usually you're under a time constraint, and so if you can drive, it's usually easier. But we will go to New York. We will go to other states, but usually Chicago is one of our top.
What is it, the clinic that used to be, there was a clinic in Tennessee that moved
Right over,
just
over state lines.
in Illinois.
Of Illinois, because that is the main state. Is you have to just get over the state line to get the services that you need.
And then there's also mail order medications.
Yes.
That are hard to get, they are often delayed, and sometimes they're from another country that you may question.
Yeah, if you're gonna do mail order medications, it would behoove you to email Planned Parenthood, go to abortionservices.org. Like, there are places to get services and get that medication, and then they can also tell you where to get an ultrasound after, because the main problem with those services is if you're getting it from overseas, you might not fully abort the baby, and then you can have sepsis, which requires you get into the gray area at the hospital of whether you can be treated or not.
Can I comment on that? So speaking of that, I mean, even if you go to an abortion clinic, say in Illinois, a lot of times, I think 60-something% of them are now medication
Yes.
abortions because there's such a high demand. Oh my, and that's also something, the number of abortions that Tennesseans are having since the law passed has escalated like you wouldn't believe. So it's about 60% are medication abortions where you take 2 different medications and it causes you to pass the fetus or the embryo that you're carrying. So there is a decent number of those, or a decent percentage of those, even if the medications are right, that still has some tissue that remains in the uterus, and that tissue can get infected and cause a lot of pain, a lot of bleeding. And that was something I see in the ED probably every shift I work, and I work 8 to 10 shifts a month. And sometimes more than one, where there's retained products, they continue to bleed. So why does that happen? They didn't go to a physician or a clinic here, so they don't have a place to go back to. And they're scared. They can't go to their own gynecologist if they have one and say, hey, I had this medication abortion, can you help me? Because now I'm hurting and bleeding. So they go to the only place they can, which is the ER. And it's a simple treatment if they come early enough in the process, but they don't have anywhere else to go. And it breaks my heart, so now it's about me. It breaks my heart to have to see these people who are scared and they don't know what to do, and they were scared to go to a doctor, and they could have gotten care easily, but their doctor is in Illinois.
And just to say, some people might be like, why didn't they just stay in Illinois or stay somewhere until to get a scan, or to get the ultrasound? That all costs money and time, and you're away. They might have children, school, they can't take off work, so you have to come back. And that is usually, again, disproportionately affecting a class of women in our state.
I'm interested, Dr. Schlechter, you said that abortion care has, after the law, increased
The number of abortions, I read that.
Yeah, it did,
Okay,
yeah, about by 30%.
Yeah,
30%.
yeah. It might be that we're able to track them more, I don't know, but
I think it's, for what we have found at Planned Parenthood, it's that
We're able to track them more, and we're also having more people tell us about it. Before you could go to your doctor, not everybody was going to a Planned Parenthood or having to reach out. So now there's just more contact with organizations that can help you.
Well, I'm glad you said that, because that has always been in the back of my head when we have talked about abortions not being, not just readily available, but more people actually having abortions than we really knew. And the tracking now is so much more prolific, I would say. So we have a few questions from the audience gathered, and I will work to make sure that we touch on all of them. But first, is the Tennessee law impacting OBGYNs coming to or remaining in Tennessee? Is it impacting Tennessee medical school admissions?
why, yes, that's in my notes to make sure I said that. So that question, thank you for reading my question. I did not read that question. So we have decreasing, we're having to go deeper in our residency match. So there's a match for OBGYN residency. We're having to go deeper into the pool to get someone to come to the state of Tennessee. We have fewer people applying to residencies in the state of Tennessee. We have more, I'm seeing this personally because I work with the UT group in Nashville, and more residents are leaving the state after they complete their residency and not staying here, because why would you want to practice in a state where it limits what you can take, how you can take care of your patients? We have more physicians retiring earlier, more OBGYNs retiring earlier, and or moving away, especially people who take care of these high-risk pregnancies, maternal fetal medicine doctors, and there's a advanced family planning fellowship now, which is people who know how to end pregnancies that are further along, which is sometimes very necessary medically. Those people are not staying in the state, which means some people can't get the care they need in our state. And of course, we have hospitals closing their maternity services throughout the state, which is resulting in maternity deserts. It's scary. Oh, and I was gonna tell there's a story about, there's a UT resident right now who is in Washington State somewhere learning how to treat miscarriages and do D&Es, which is dilatation and evacuation of a uterus, further into the pregnancy, because we can't train that in the state of Tennessee. So, and we have to, by American Board of Obstetrics and Gynecology, we have to train that. We have to be trained in that, and we can't train in that in the state of Tennessee. I hope that answered that question.
It absolutely did, and we think that the law is just stopping abortion, but it is stopping care long-term. And one question I did have from something else that was said earlier, for the people who go out of state to Illinois, receive an abortion, and come back and have remnants that they have to go to the hospital for, is there the possibility that they can be charged, or are there other kinds of considerations they have to think about as they go to the hospital?
No, because again, the patient can't be charged. Sorry, do you know this? Patient can't be charged, but they don't know that because we don't know the laws, we don't understand the laws, so why would they know that? I know that, but the patient doesn't know that, so that might be a reason that they delay coming. And then, of course, will their insurance pay for it? Because they did something, they got there by doing something that was illegal in the state. But I mean, I don't know, do you know? Are they gonna?
That hasn't been tested, but it is a gray area where insurance might not pay for it, or you could get a delay of care while they're trying to figure out what is going on. So we, at Planned Parenthood, we try to get you to main hospital centers, and we say to go get an ultrasound if you have abnormal bleeding. But again, if you've never had if you never terminated a pregnancy, you might not know what abnormal bleeding is as well. You're now put in the role of a doctor to know what the symptoms are. So you might just delay it just because you think it's normal as well. So just your own knowledge of what is supposed to happen. Because most women, even though it's said that people use it as birth control, that's not what we see in our statistics.
I'm so glad you said that, because both of you had said it earlier, that people are not just going to the clinic for an abortion because I made a mistake. So I probably will reiterate that 2 or 3 more times and won't have a problem with you all doing it. These are great questions from the audience, so I'm going to move to a number of those. And they're in no specific order. Do we have any reports of someone dying as a result of delayed care?
We have, I can't give you specific Tennessee results, but we are starting to get the stories, because it's been about 2 years, of women dying because of delayed care, because of having to go to a different state. In states like Georgia, we have Amber Thurman, who passed away, and because she had to go to another state, come back, and she didn't fully pass all of the fetal tissue, and ended up passing away. So as we go on, more and more cases will be reviewed, and we will see a rise in how many women are losing their lives or losing their reproductive, like their ability to reproduce. Because even if you do not pass away, that does not mean you do not have damage to your body.
And I'm gonna add to that, the reason, so that was a 2022 case, and the reason those cases are delayed, like why are we just hearing about this now? Because every county has a committee that reviews every maternal mortality and every mortality of a child, so anybody less than 18. I actually happen to sit on that for Davidson County, so I know about it. So there's always a delay getting those cases declared preventable or not preventable. So those 2 cases in Georgia, if I'm not mistaken, but the one that's been so publicized was just now declared preventable. That's why we didn't hear about it for so long. So everything takes a while to get the data. So I anticipate that we will hear more and more stories, because once they're declared preventable, the press will get a hold of them and we'll hear more.
In cases of child or teen pregnancy, where the child is forced to carry the baby to term, are there any aspects of these laws that put financial or legal responsibility on the father?
No, there are no aspects that put the legal responsibilities on the father, and there's not a lot of responsibility put on the father in general.
That's been,
Yeah. Do you have anything to add?
no.
Because I think I have heard that there has been a wee bit of activism around, if we are going to force people to carry babies to term, then there should be some legal enforcement of care for those babies on the part of the person who impregnated the person versus just on the part of the person who's carrying the child.
You can file a civil suit, and you can try to get money out of the sperm donor, but that doesn't always work, or doesn't often work. The other thing, though, is with the abortion trafficking law, the sperm donor can file a civil suit against the physician who who assists the patient in the woman in getting, or the child in getting out of the state of Tennessee. So they have rights in one direction, but not responsibilities in the other. Yeah, that is stupid, thank you. To agree more, and I'm just gonna mention that people go, well, but we can adopt these kids out, but the foster care system in the state of Tennessee, again, you probably know more about this than I do, it's not as good as it would like you to think it is. I just, from what I hear, and I don't know, I'm not an expert.
It's not great. It's not great, and it is overworked and overloaded. So it's not like there's no lack of kids that need to be adopted in found homes.
Absolutely. What is the impact on OBGYN malpractice insurance premiums of this Tennessee law?
Super good question. I don't know that that's a great question. I don't know of one. I will tell you, though, that malpractice providers will say, we will not cover, if you get charged, we will not cover your legal. I do know that. That's the only thing. So I guess that's why, since they're not gonna cover the legal, expenses, they don't have to increase what they charge you. So that doesn't really help, does it? Yeah, but I will also tell you that when asked that question to my hospital system, they did say they would. And I am here, oh God, I forgot I was supposed to say this. I'm here representing myself, I'm not representing the hospital where I work, or the hospital system. I just know them really well. And they have said that they would help with legal, charges if something came up, which I thought was really good.
Absolutely, because some folks just don't want to provide that kind of support, and so that Ascension St. Thomas has is a wonderful thing. What information and policies have been given to physicians from hospital administrations regarding this issue?
Well, I can speak for my hospital system. So I became physician chief of women's services for a hospital system in July of 2022. That's when that's the month, thank you very much, timing is everything. I also became CMO 2 months before COVID hit in Nashville. I'm not kidding, I have luck like you wouldn't believe. I don't follow me home. So when that law went into place, I gathered from Ascension National, legal, ethics, mission, it's a Catholic-based hospital, anybody I could think of in a Zoom meeting and said, I need your help. And they gave us a set of policies, including how to document, who needed to document, what we can do and what we can't do based on Catholic law. And then that group was available to me anytime a physician asked me a question. I know that one story about that one hospital that the legal team was aware, but they hadn't hashed everything out yet. And so there was that one documented delay. I don't think that continued. The hospital systems were on it. And I can't speak for any other hospital systems, and I apologize, but that was an issue that everybody was like, can we say that, oh shit, we have to figure this out. So hopefully they all did.
Good question. Did you want to say something else? All right, so we have, I understand we're ending at 1 p.m. It is 12:57. We have 3 questions. So I say all of that to say, we have to come back. We have to make sure that these kinds of forums go beyond these walls, right? Because I'm sure I'm going to have more questions as we leave, as you will. So I'm going to get right to the questions. I'm going to leave that one for last because it's an advocacy question. For Stephanie, outside of the Planned Parenthood phone banks and visits, how else is Planned Parenthood informing people about anti-abortion laws and misinformation in Tennessee?
That's a great question. We do town halls, which are virtual and in person, to help people learn. The canvassing does help us to get the information out, and we send out a lot of information. But for us, also, it's people coming to us and asking the questions. So things like this help. We try to do as many panels and speaking engagements as possible to be in the community and share the information that we have. But we try to do a virtual town hall at least once a month on a national level, and all of our affiliates.
Awesome, thank you. Cool. Here's a good one. Can legislators who passed the law that did not allow a woman care be sued for the harm to the women?
I don't believe so. I mean, I guess.
We might have somebody here who could help with that.
Yeah.
They have immunity for legislative acts.
Yeah.
I mean, they passed the law, they have immunity, so no.
Yeah.
The
Shame.
only weapon is have them not be reelected.
Yes.
There's your weapon.
Absolutely.
It's the ballot box.
Absolutely.
Yes.
All right, final question. Have you met with and shared these stories with legislators? If so, what has their response been like?
I think both of us have. Planned Parenthood we have an advocacy wing where we do speak to legislators, we talk to candidates, we make sure we endorse some candidates based on the values that we share. It is an uphill battle here in Tennessee with our current legislative offices, but we are present, and as our next legislative session that starts in January, we will be there.
As a board member of the Tennessee Medical Association and the National Academy of Medicine, we do have what we call Doctors Day on the Hill, where physicians, I brought my white coat because I I needed it. I'll go in white coats to the legislators and try to have conversations with them. So we have that kind of opportunity. I have personally spoken to a subcommittee of the House on the abortion trafficking law. And I went there and they listened, and my personal representative said, come meet with me. I'd love to meet with you. And I called his office and I was told there weren't appointments, told there weren't appointments, told there weren't appointments, and I still have not met with him. Cheatham County, in case you're wondering. And so it's not that easy, but we try. We're trying.
We try. We try, and we are always, when we do events and when we do talk to them, for Planned Parenthood, we always have a forum after to tell you what we have found out. But like she said, it's very hard to get appointments. It's very hard to know what it's getting through.
2 more questions. We got a little permission to go a little longer. One is looking ahead. There have been journalistic reports of lawmakers considering a ban on IVF treatment and contraceptions. How likely is that to become reality?
I'll say from Planned Parenthood's view, we believe that there is a potential that it could be likely depending on when life begins and when that definition is born. So when you have IVF and you're making embryos, are those embryos alive? So again, it's going to depend on what laws are created. But right now, it is legal. IVF is legal, contraception is legal, but that can change.
And I would say that I would never believed that I was going to be put in a position of caring for patients the way I'm having to care for patients now. So I would have previously said, oh, come on, that could never happen. And now I would say, I don't think I can say that to you. So I think it could happen. Stock up on your birth control pills, ladies.
While it has not been restricted yet, IVF and birth control, there was a bill presented in the last legislative session trying to protect it, saying, hey, can we guarantee access to IVF and birth control in the state of Tennessee? They promptly shut down the bill to protect it. So while they have not yet outlawed it, they did refuse to protect it. And I
More
would
than
not,
once.
right, and I would not doubt the willingness to go how far. You were talking about the, children giving birth. I was at the Capitol the day that Representative Gloria Johnson brought forth an amendment to try to make an exception for children under 13 who are victims of rape and incest, and that bill did not even make it through committee. They immediately shot it down. So if there's something extreme on your mind, it is not outside of the realm of possibility with our legislature.
And the rape and incest, that was also proposed, and it was also shut down.
Yes, yep.
Really?
And that has been done locally, like statewide and federally,
Yes.
both times.
That is correct.
Final question. How can we help?
For Planned Parenthood, for us, it's supporting Planned Parenthood, and if you know of anybody, having them reach out. We can't do our work if we don't know who to be helping. That is the biggest thing, and there is shame, and there are people that are scared that they're gonna be breaking a law or anything, so our doors are always open. Like, my email is always open. The emails I get all the time that I can forward to another provider. We just contact us and support what we are doing at Planned Parenthood, because again, we do far more than just abortion services. We are an education service that helps women and men with their reproductive lives.
And pastors. And pastors. And vote. And vote. Talk to your legislators if you can. Good luck, tell me how you do it. Talk to each other, talk to your friends, talk to people you know who are voting, because they don't understand the laws either, so maybe you guys have more insight, you can spread the word.
And we do, if you want to know, I can give you my email. We do have a voter guide it's nonpartisan, but it tells you what everybody is supporting. So you will know who is supporting reproductive rights on your local ballot.
Be nice to your ER doctor. She seems harried when you go.
As I turn it over to my good friend from the League of Women Voters, thank you all for having us.